the speaker. And our keynote speaker we complete from Dr. Parvin Jareen. Thank you, dear. And another Dr. Anwar H. Bishas from our Government Homeopathic College. You know, in Bangladesh, only one Government Homeopathic College. But this is the only one Government Homeopathic College. They are every year 50 students take admission. So he is the in charge of his department. Another our first allopathic government hospital, that is Bangladesh University, and he is the Dr. Timir. He is the really renowned and experienced allopathic doctor. Another speaker was Dr. Dorothy Floren. She was from Netherlands, but the time is really too late, so that's why we got a recorded video, and that's published on my YouTube. If you go my YouTube, there you'll find his 15-minute recorded video. Another our senior speaker, Dr. Abdul Kabir.
Greet everyone who joined this event today. Good morning to the Eastern, time zone, and good evening to the others. And it's my great pleasure to be here at this webinar on Homeopathy Day in the honor of the father of homeopathy, Dr. Honeyman. That was actually the birthday was yesterday, that we are honoring it today. Dr. Ola, please just turn off them. And yes, we are coming together today in honor of the father of homeopathy, Dr. Honeyman. Yesterday was his birthday, and today we are celebrating it. And I would like also to express my gratitude to the webinar organizer, Dr. Ola, from Bangladesh, who is our ambassador and collaborator in Bangladesh, who has been doing a great job so far. And also his kind invitations. Today, I am his guest. I'm not an organizer. He's the organizer, and I am his guest. But graciously, he allowed me to go first and talk about, homeopathy and everything. Today, I want to take you on a tour, like a short tour on our academy, first of all. A little bit of the academy I would like to talk about, so you might, for sure, our collaborators know about our academy, that is when it was established, and where are the locations and everything, and also what we are offering. So as an international educational platform around the world. And the Bioquantum Academy is I can say, is a pioneer for transformation. As I explained to you a little bit earlier, that homeopathy was almost dying, and it needed somebody to lift it. It needed somebody to survive it. And I'm so honored to be one of those people, and that person that I did. So I was often asked, why you're doing this? That is a hard job to do, especially in North America. And because pharmaceuticals is huge in North America. Actually, it was born in North America. And imagine single-handedly, you want to go to the chest of this, pharmaceuticals that, they're completely against you. They're completely against what you do and against what you offer. And this is something that came to me as a realization that if I don't do it, then who's going to do it? So I'm definitely, I appreciate all the homeopaths before me as grandparents of homeopathy in North America, and also the ones that they worked along with me, and also the Bioquantum Academy that is completely brought it to full-fledged system of education. Bioquantum Academy is going to transform. It's a mission, it's a movement, and is going to transform the medical communities. We are not working with the current healthcare system. So that's not our aim, that's not our goal. The reason was that for decades, I personally fought for this to bring homeopathy to the healthcare system. And in the beginning, we were so disappointed that why is not doing the government of Canada or United States, they're not helping us to do so. But at this present moment, I'm so happy that it didn't happen. That brought me to the point that to create a new system of education, to create a new system as a new healthcare. Because it's not only for me, it's not only for you. It's for children, for your grandchildren, for next generations to come. Because as homeopaths, as doctors, as healthcare practitioners, as medical practitioners, we are liable for our next generation. It's not only for us. Yes, there is a lot of sacrifice going on. I sacrificed my family. I sacrificed my time. And I sacrificed my almost financial. For what? For now, to be at this platform, to teach it to medical doctors, to transform the healthcare system as a new system. So, we offer a very comprehensive, revolutionary, and I could say one of a kind, educational platform internationally. So I started health campaigning, Canadian National Health Campaign years ago, and I brought Bioquantum Academy around Canada. Then I realized that why not the entire globe? So there are many, many countries, they're hub of homeopathy, such as Bangladesh, such as Malaysia, such as India. So they can come together and bring this movements further. So at this point, Bioquantum Academy is registered provincially, federally, and also registered trademark for credibility, for legitimization, for accreditation, and a brand protection. This ensures the quality and authenticity of the Academy and our international educational platform, and it's a milestone that I am and you all are proud of. In Canada, in around the world, due to large scale of demands for understanding these educations, and they have come to the term and acknowledgement that they want to know what is homeopathy, what is integrative medicine, what is these compatible natural modalities are coming from, how they can bring it to their own practice, how they can transform their practice, either they bridge into the new natural modalities or completely convert, or they just simply add it to their practice. This is something that they are stuck. Medical practitioners are stuck. They don't know. They didn't know how to do it. They want to do it. They know that they know that allopathic model has been failed in so many conditions, and they want something to replace it, but they didn't know how. So Bioquantum Academy is doing it. So through my practice, I realized that what's the best way to collect all this data and information through my practice and bring it under one umbrella of Bioquantum Academy to teach it to medical doctors, not to be confused, because medical doctors are not supposed to be confused. Otherwise, they leave the disciplines, the natural disciplines. There are many natural disciplines that are not compatible. The medical doctor should know that which one is compatible, which one is not compatible. The Bioquantum Academy is teaching it, that the ones that are compatible, they're coming under one umbrella of integrative medicine. So when you go to some other platforms, they call integrative medicine, that their allopathic or conventional medicine is coming along with homeopathic medicine or natural medicine. That's not what we are teaching. Integrative department is not teaching and is not compromising the education, and the truth of knowledge with allopathic model. Allopathic model has its own agenda, which we salute them for anything that they can, but we're going to criticize and also help them for the ones that they cannot. So at this point, the best way is just to come together to understand what we have to do. One of the ones that they came to the acknowledgement, because this platform is mostly for medical doctors. And we have been doing an amazing job so far. Dr. Otami is one of our wonderful collaborators. She's a medical doctor, and she has brought this platform widely to her country among medical doctors. And we had several graduates since a few years ago, all medical doctors. So when they come to understand that what we can do along with what they practice and what we can teach, not to have any interactions in terms of negative, interference, then is the best way. So Bioquantum Academy teaching that. And we have developed, as I said, a new model for the future healthcare that integrates modern science with holistic and quantum-based approaches, offering a comprehensive education designed to promote a true natural healing and long-term health and well-being. In line with this mission, we created different departments. I would like to just take you to a tour with our academy, just quickly, maybe just a few minutes. Dr. Ola, you can moderate me, because I have no idea if when I talk, I talk. So somebody has to stop me at this point. Let me just get the website going. Okay. I'm sure some of you might have, had a tour on our website, and the website is very comprehensive. So you can go and check all the different departments and what we do in terms of advanced homeopathy and advanced integrative medicine. What I want to specifically do today to give you a tour is the educational departments. So we have several different educational departments. The very first one is classical homeopathy. Then is medical homeopathy. So there's differences between two departments, which I can explain it if you have any questions on it. Department of Integrative Medicine, Department of Nutritional Sciences, Department of Biocosmetology, which mostly are the medical doctors that they are practicing in the field of dermatology. And we have medical ethics, we have Department of Communications, we have the Department of Faculty members and students and graduates. So today, let's just have a tour on shortly on classical homeopathy and integrative medicine. So as you all sure, not the Indonesian are all medical doctors. But in Bangladesh, I'm sure a lot of homeopaths are at this event, and so
there are also allopathic doctors also in join with us.
Okay, perfect. So welcome all of them. Welcome medical doctors. Welcome all homeopaths. But what I want to have a quick tour on our classical homeopathy. There might be a little bit of differences between what we do here than the other maybe platforms. But what's something that is very important to me as a homeopath is that not to forget the philosophy behind anything we do. We're not just going to stop with the art or science of the practice. the philosophy of the practice, philosophy of what we do is the framework of the science within it. So you just go with the material medical, or you just go with the repertorizations. Yes, that's a great art of homeopathy. But to understand what homeopathy comes from and what the science behind it, and it's very important. So what we teach at the classical homeopathy department is generally what homeopathy is, introduction to the world of homeopathy, history and origin of homeopathy, and laws and principles, and concept of healing and laws of cure, which are the basic things for teaching homeopathy. Everybody are familiar with these basic rules of homeopathy. But when it comes to just to understanding philosophy, in the fundamentally understanding philosophy and homeopathy, you have to understand the philosophy of what you do, philosophy of your practice. The problem with the allopathic model that is failed in so many situations because they're stuck with the science of. They are working in the frame with the science of what they do, the science of medications, the science of artificial drugs, the science of that. But there is no philosophy behind it. The philosophy is the framework that the science can function within that framework. And if there is no framework, science can collapse. Science can be destructive. Science can do nothing. So we are in the era to understand how much philosophy of what you practice is important. So we teach it. We teach philosophy. In this, aligned with this mission that philosophy is first, science is second, but they both are meeting each other at the meeting point, which we teach it at the Quantum Academy. And the next 2 weeks on April 25th, and in align with this mission and movement, we are having a great academic conference on this intersection. The intersection of philosophy of healing and science of medicine. If you separate science of medicine just like that and go and treat cancer patients, go and treat metabolic patients, you fail. You have to meet with the philosophy of that side, with that practice. So we teach it here. We teach the law of holism, the ancient philosophy of like cures like, and so like cures like is the main law of similarity of homeopathy, which the Dr. Samuel Hahnemann brought it to full-fledged system of medicine, as he coined it homeopathy, right? But like cures like is an ancient philosophy from thousands of years ago. Dr. Hahnemann used it to develop a system of medicine. He's a genius doctor, and he was a medical doctor. So, but like cures like is an ancient philosophy that we teach it at the Department of Homeopathy. We teach the 5 elements of life, which is very important, is aligned with our mission, aligned with homeopathy. And also we go to the history of homeopathy, who are the pioneers of homeopathy, and the revolution of homeopathy, and the comeback of homeopathy in 1970 in North America. So, and as you all know, homeopathy is originated in Germany by Dr. Samuel Hahnemann, and it's expanded to different parts of Europe, and then it came in 1800, it came to United States and Canada. Canada was a very pioneer of homeopathy, but unfortunately, as I mentioned earlier, it was attacked and had a very sad story, and I'm so glad that we brought it back. So then we talked about science and art of homeopathy, the science of quantum physics, and homeopathy, science of water. So I have a research of 20 years on this. I graduated as a homeopath, but I didn't know how homeopathy works. It works, but how does it work? For me, was a question. So as a philosopher, I always have to look into philosophy of that, and then philosophy with the logic and reasoning takes me to the science of what I practice. So we have publications at the site, and there I have all my research are there. research of homeopathy and with the disciplines of our uncertainty principles and also superposition. So whoever knows, educated in quantum physics would understand exactly. Who are not educated, then this my articles would take you there to get to know the science of homeopathy after the philosophy of homeopathy. So we teach understanding of particles and waves. So one of the questions that we often ask that homeopathy doesn't have anything. How come you say it's healing? There is no substances. There is no particles in homeopathy. And we kept saying it is information. We kept saying it is an imprint of the original substances. We kept saying, but they have to understand it. What does it mean, that information? So how, then I teach it, how that particle, that we remove it as a physical entity and we transfer it to the wave that we call it information. This is something that is very fundamental and homeopaths should understand it actually before they're practicing it. I didn't know it because the school didn't teach me. But I don't let one homeopath to be graduated without understanding of philosophy and sciences. And it's not only materia medica and repertories. So, and there are many, many other parts. So the study of homeopathic medicine is like a polycrest medicine, keynote remedies, small remedies, concomitant remedies, compatible, inimical, what medicine will follow well, what is not followed. These are all things that we teach it, during materia medica. And also we teach the homeopathic dictionary as well, because homeopathic dictionary is not a medical dictionary. So it's completely different. And whoever wants to be a homeopath should master this homeopathic dictionary. Then we do the repertory, how to find the medicine, the most similar medicine to the picture of the disease or the picture of the person. And then we teach how to do the differential diagnosis. So there are a lot of different books that I have. I have almost 500 books around me. So if you have any question, I can show it to you. But we go through each book during this training. And then we get to the advanced part of homeopathy for emergency, for acute, for bleeding, shocks, grief, palliation, and also we go to psychology and psychiatry. For system and organs, we do dermatology, in surgery, in oncology, in autoimmunity, dentistry, pediatric, and gynecology. So homeopathy has every protocols for everything. Dr. Ollau just mentioned that homeopathy is great in female disorders, and he's having I think practice for female problems. So homeopathy is very ahead for gynecology. So, and also we get into the homeopathic kingdoms, where homeopathy comes from mineral, plant, animals, and how the preparation, dilution, and potentizations, and on and on. And also they have advanced courses such as nosodes, sarcodes, esopathy, and tautopathy, that it's great for medical doctors to know. And then we go through the disease evolution, case taking, and case analysis, and the constitutional understanding, and then we go to the research. The research paper is the thesis that the students at the end of the program, they go through it, and then, they attend all the certification webinars, they attend all the international conferences, and goes on and on, okay? So we are operating according to the medical ethics and professionalism. We are operating according to the regulations in Canada. We are operating according to the bylaws, provincial, and laws federal. So we are board certified, and also all our graduates can be board certified as well in the scope of practice. So these are all about the so this is this department, the intersection of philosophy of healing and science of medicine. I just, duplicated, and I teach it in classical homeopathy as well. So to understand the ethical roots of medicine that currently is under practice is so unethical. There are many unethical situations that we can name with this system of medicine. But we have to teach the morality of science and ethical roots of medicine. Otherwise, we fail. Okay, after that, I'm going to go to, I'm not going to go to the medical and biocosmetology. I'm going to go to the integrative medicine. Integrative medicine, we chose courses, departmental courses, very carefully, that they are compatible with homeopathy and they are compatible with what. Okay, this is the department of integrative medicine, that whoever is a homeopath, is medical doctors, in medical practitioners, they want to be integrative practitioner. So we have so many different modalities and natural modalities that they're compatible with homeopathy, and they're compatible with their medical doctor, with their conventional medicine as well. Okay, so homeopathy as itself is not compatible with medical, with conventional medicine at the same time. It can be aligned, but there are many other disciplines that we teach at the Bioquantum Academy that are completely compatible with conventional medicine, such as chemotherapy. Dr. Otami already knows that many students, took chemotherapy. We have phytotherapy medicine. We have epitherapy medicine. We have bee venom therapy in a homeopathic form. We have oligotherapy, herbology, homotoxicology medicine, and homeopathic medicine, neurobiology, and for chronic diseases, metabolic disorders, epigenetic corrections, and also music therapy with our professor, Dr. Leonard Horowitz, and also holistic nutrition. So these are the integrative disciplines. There are many other courses that they are not here, but we can teach it by request. And so homeopaths can take all these courses, allopaths can take all these courses, nurses can take all these courses, dentists can take all these, pediatrician, gynecologist, anybody can take all these courses, because we very carefully chose the modalities that can be compatible with everybody. So, any questions about these two departments? And Dr. Ola, please tell me how much time. Yes, go ahead. How much time do I have for my PowerPoints?
So you have 45 minutes, so more than 15 minutes you can continue. Then
another 15 minutes?
Yes.
Okay. So, okay. Oh, my time is running out. Okay. So let's do this.
Then Bangladeshi doctor will join, or honorable other member. They will speak in Bangla.
Okay, awesome. Okay, so doctors, anybody, I apologize. So you have any questions in regard to the departments, you just write it down or pass it to the chat, and Dr. Ola is gonna, read it for me, and I would answer it after my talk. Okay, so again, welcome everybody to my talk today, and for whoever just joined the program. Yes, we are at the platform of the Bioquantum Academy. This event actually is organized by Dr. Ola from Bangladesh. I appreciate it, and he kindly invited me to talk at his event. But generally, he's working with the Bioquantum Academy. We are all working together. So Bioquantum Academy is the pioneer of a missionary movement to transform medical community by establishing a new system through a revolutionary education platform based on ancient philosophy and modern science. So I think you all know me. I don't have to introduce myself. If you want to know a little bit more about me, please go to the Academy's home, and everything, all my documents and everything, my education, myself. The only thing that I don't put it there is my age, because I just kept it private at home. But I mean, everything else is there. So yes, I'm the founder of World Homeopathy Academy, founder of Integrative Medicine and Nutrition, and also Homeopathy Clinic. So Homeopathy Awareness Month is April. I thought it's just a day, but then I realized it's a month. You know, I went to Google and said, oh, Homeopathy Awareness Month. Let's expand it to a month, and for more people to know about homeopathy. So as I mentioned earlier, yesterday was the birthday of Dr. Hahnemann's, the father of homeopathy. So homeopathic medicine is the second largest of medicine around the globe. Second largest system of medicine around the globe. It could have been the first system of medicine if it was not attacked and the medicine was not monopolized by pharmaceutical industry. Imagine why homeopathy, after all this attack, and after all this suppression and oppression, it's still the second largest system of medicine, because it works. It just works. So that's a reason. But the main thing is that we didn't have that such a huge, you know, we are a giant community, but I mean, we wanted to be the first one, is that we have to train homeopaths in a right way, that to become the first system of medicine around the world. So, and if they monopolize the medicine, we're going to create our own system. So nobody can monopolize us. So homeopathy is a complete system of medicine that is the best choice for countless chronic diseases, for many acute conditions, emergency cases, traumas, malignancy, infectious diseases, epidemic, pandemic, autoimmunity, and for innate immunization. So we call it at the World Homeopathy Academy the world of homeopathy, past, present, future medicine. So we have homeopathic group, as I mentioned earlier. So there's a lot of, come under the group of homeopathy, even integrative medicine, that are compatible with homeopathy. They come under one umbrella. So philosophy of healing, philosophy of homeopathy is equal to philosophy of healing, because healing will never come from outside. Healing is the power and ability of your internal. It's an internal ability that it just needs to be stimulated, activated, and supported, which homeopathic medicine does. Healing is not by any homeopaths or any doctors or any copy-pasted medications in the laboratory. That has nothing to do with that. Healing is the power that is endowed in every single human body by nature. And this healing ability, from the day of conceiving to before that, is with us. We just have to activate it. We just have to listen to it, and we just have to support it, repair it, and all this. Because nobody is going to come to heal you from outside. There is no such a thing. Doctors going to heal you. You are healing yourself. So we call homeopathic medicine, we call them remedy. Remedy means to support you. And we call them medicine remedy, but the one that is allopathic or conventional, they call it drugs or medications. So medicine is natural, remedy is natural, comes from nature. It's not a copy-paste in the laboratory, right? It's coming, for example, homeopathy comes from the three kingdoms of plants and animals and minerals kingdom, which are all on the earth. So they come, they dilute, potentize, accordingly, and with the same, imprints of the original substances, and we call it energized medicine. I call them genius medicine, and so That's homeopathy. And medication is artificial. Medication that is, made synthetically, artificially, is artificial. So medicine has healing power, property. Anything that comes from nature has healing property. In different medicine is chemotherapy, is phytotherapy, is even honey has a healing property. How to use it is very important. And but medication has a suppressing property for quick fix, because that's the way that they want to manage the disease. So medication refers specifically to prescribed or formal pharmaceutical drugs, while medicine is a broader term encompassing substances as remedies. A natural substance that can stimulate, support, and help the human body to heal itself is a medicine. This natural substance could be food nutrients, or naturally derived substance from the plants, minerals, and animals in form of extract, essence, sap, herbs, spice. Some spice, they can be medicine that can help activation of healing ability. Some spice is activating your healing ability and moves the body to overcome an illness and heal naturally. Naturally derived medicine on the umbrella of integrative medicine has its own power, which is endowed within them by nature and giving them efficacy to help us to heal. You got to listen to this phrase. Giving them efficacy to help us to heal. It means we are the one who heal ourselves, nobody else. But what we have to get to help that healing process, to help that healing ability, could be a nutrients of food, it could be herbs, it could be a remedy of homeopathy, it could be anything that it comes naturally to your body, not artificially to your body. Because anything that artificially comes to your body goes against you. It might momentarily feeling better because it's suppressed. That's how they manage it, right? They're artificially, managing it, but you're feeling better. But it's going to move the disharmony much further, deeper within you, that is going to come back tenfold. So that's how the body works. Sorry, I'm so interrupted with a lot of people coming in and nobody's admitting them. And I'm so okay. Let's get into my analogy for disease, because I have an educational model. So I don't go with any mainstream. So if somebody wants to know me, I don't go with any mainstream media, mainstream medicine, mainstream financial platform, mainstream. Everything is created by myself. So that's how I run my life. I'm not a mainstream person. I'm my own stream person. So, and that's why it comes to education, I developed a model for education, because the way that I want to understand it, I want to teach it too. And Einstein was saying that if you cannot make a 6-year-old understand what you say, means you don't understand it yourself. This is very important to simplify everything. No matter how advanced you are, I'm so advanced in so many things, but when I teach it, I simplify it. Because that's very important for even we are doctors, doesn't matter, That's why I create teaching models. So different disease, in mainstream, again, they say diseases, diabetes, blood pressure, high cholesterol, cancer, autoimmune. And then cancer has breast cancer, ovary cancer, prostate cancer. And then autoimmunity, say, oh, this is a psoriasis, this is a lupus, this is a arthritis, blah, 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 blah. There is no such a thing. There is only one disharmony. Only one. Human body has only one internal disharmony, but with countless manifestation of that disharmony. It's called disease. So if you want to go after disease, don't go after symptoms. Symptoms are the manifestation of one internal disharmony. You just bring the body back to homeostasis, restore the physiology, you remove the disease. It's not that rocket science. It's so simple. You just have to understand how to do it and the mechanism or the tools that you have. There is one disease. In homeopathy, we don't have diseases. And in nature, we don't have diseases. And in human body, we don't have diseases. It's one disharmony, but countless symptoms, manifestations of symptoms. That's why we collect symptoms as guiding symptoms to understand the person who is diseased. We don't go after symptoms. We do not go after pathology. We don't after the pathology or terminology of pathology. We don't go after that. We understand the pathology by collecting the symptoms. Then we go after the disease, the one disease, to remove it. Because if you go after the symptoms, you're suppressing the disease, which is still trapped within you. This is completely against philosophy of healing. That's a problem that allopathic model is failing because it doesn't go with philosophy of healing. It just goes with fixation and managing. The symptoms is the communication and the language of your body that is warning you, is talking to you, communicating with you, that there is an internal disharmony within me. There are 10 people comes to me with the same terminology of pathology of, for example, diabetes. Do I go after diabetes? Absolutely not. I go after the disharmony that makes her sick with the symptoms of diabetes. That's how the philosophy helps you to understand. That's why the science can be destructive without the framework of philosophy. So allopathic model have failing chronic conditions. Again, I don't get me wrong. In many cases, we salute them. In many cases, such as trauma care, such as accident, surgery, and whatever, they have done amazing job. But when it comes to chronic diseases, they fail and they keep failing. Suppressing or managing the disease never removes the disease, but moves it deeper and creating complex disease. The problem with nowadays, with people, is not a natural disease. It's a complex disease. Because from conceiving time to now, the babies are born in a toxic world with medications, with drugs, with pollution, with intoxications. So there are times that it's very hard to find the right picture of disease because it's complex disease. The only one that can remove the complex disease is homeopathy. Nothing else. I'm an integrative practitioner too, don't get me wrong, but I have to be truthful. Because the majority of cases that they come to you, they come to me, they're suffering from complex disease. Because natural disease is so easy to remove. It's not rocket science. But complex disease needs a rocket science, which is homeopathy. Healing is the natural power of human body again, and the healing ability is endowed in all living beings, plants, animals, humans, by nature without exception. So any living being in the nature, they have this power. The plants have their own healing power. Animals have their own healing powers. So is human. So never underestimate your healing power at any phase of disease, no matter benign, advanced, or malignant. You can heal yourself no matter the stage of disease. You just need right rewinding mechanism, right tools, and right environment. So the healing is the job of your within. It's an internal job. It's not an external job. The body heals and naturally cures itself from within by the help of right medicine in right environment. The main thing that I want you to keep in mind that healing always follows the natural laws and principles. If you violate these laws, if you violate and deviate from these principles, you will never heal yourself. Never, ever can heal yourself. What we have been facing in this era is these natural laws and principles are deviated and violated by so many wrong systems of medicine. So core principles of homeopathy is designed based on healing principles without deviation and violation of these laws. Allopathic model, it keeps violating these laws because the man-made rules, synthetic drugs, cannot go along with the law, natural laws and principles. It's deviation and violation. The laws of nature. We are absolute part of nature. You can't separate yourself from nature. The laws of nature are absolute. You can't violate it. You can violate it. It's the same as law. You go to jail. You become a prisoner of your disease. Nature never follows man-made rules. Human being is an absolute part of nature and follows laws and principles as it programmed. Man-made rules, administration of synthetic drugs that suppress in order to manage symptoms causes internal intoxication for life, causes immune system compromising, causes suppression and weakening by artificial medications, which is the violation of these natural laws. So violation of natural laws is the violation of the inner healing principles, which ultimately leads to complex diseases. Violation of natural laws by synthetic drugs is the violation of the framework of philosophy around science. It's a collapse of science. Healing is an internal domain and would never follow external artificial rules. You cannot do that. You can do it emergency until you put your healing power back, but not for life, the way that they have been doing it. Removing thyroid, they put the person on thyroid medication for life. They're removing ovaries, they put the person, female, on medication for life, hormone therapy. This is a violation of laws, and laws is absolute. You got to be the prisoner of that complex disease for the rest of your life. And there is no freedom. You cannot force the body by artificial drugs. You can't unless the body is aware and ready for that naturally.
Yes.
So, for example, vaccinations, the theme and the concept of vaccination was borrowed from homeopathic concept 100 years ago, but they messed it up. They have messed it up and they inject it to even the one-day born baby. It's a deviation from its original concept, which is the homeopathic concept. But vaccination became allopathic concept at this time, and it's a deviation of the laws. And that little vaccine in the bodies of a baby is going to stay for life, and that baby is going to be the prisoner of that complex disease for life. And the natural healing principles is going to be deviated. Deviation and violation of natural laws causes immune system destruction, pathways blockages, and interrupted physiology. That's why we have to bring the homeostasis and physiology back after developing this complex disease. Human body is endowed with a natural superpower and inner healing ability to heal itself at any given moment. Don't underestimate your body. Healing power needs to be stimulated, activated, nourished, and supported in order to take action. So homeopathic medicine, naturally derived substance that can do this job is a medicine, as I explained, and homeopathic medicine is number one for that. Okay, let's just go to the, we can teach. Do I have time a little bit? Just 2-3 minutes?
Yes, there are some questions also.
So I told you, Dr. Ola, you cannot stop me, and 45 minutes is too short for me. Normally, all the platforms, they give me 90 minutes. So next time, you got to give me 90 minutes. So, so in the world of natural medicine, the world of homeopathy, the world of holistic approach, we do not treat the disease, we treat the person. The person who has the disease. The disease is within the person. You cannot extract the disease and go after the pathology and the symptoms of the disease and try to give this drugs for this drug that for that drug for this, and then create a complex disease, and here you go. We treat the sick, the person, not the sickness. We do not treat pathology, restore physiology. We call it homeostasis. This is the job of natural method, natural disciplines. It's the job of homeopathy and integrative medicine. And it's a job of your healing power to restore your physiology. The problem that you get sick because your physiology is blocked. Your biological pathways, your internal pathways are blocked for so many reasons. And there is no normal physiology is running. You have to bring back homeostasis and restore physiology, then restoring the health state. It's not rocket science. In classical approach, we collect the totality of symptoms, physical, mental, emotional levels. So how science can treat a person without understanding the mental state of the person, the emotional state of the person, which is within the person, they just look into the physical aspects of it. So how come you're ignoring the other bodies? There is physical body, mental body, emotional body, and they're all working in collaborations. So how come you're separating the physical body from mental body, from emotional body, and you're trying that your science would help them, help the person? That's destructive. You have to understand the person who's sick. There are many, many times that I have girls, young girls that they stop having cycle. And they go and then they say there is no problem with physical. But they come to me and then understand the person, that there is a trapped grief in that person, that girl. The grief caused a stopped menstruation. You have to understand the person, where it's coming from. We don't give anything for hormonal. We don't give anything to bring the period back. We just have to remove the trapped grief from that person. This is just a simple example. That's why during case taking, homeopathic case taking, the constitutional case taking, should go from the childhood to now, from everything that they remember, anything that happens, any accident, any traumas, anything that happens that it affected their lives, loss of loved ones, or anything that the relationships and financial states, anything. So we have to understand the environment that person grew out. What affected that person? That's why, my case taking sometimes take 3 hours, because I'm not going after the pathology of that person. Yes, I have a machine like an analyzer, biofeedback analyzer, to give me some confirmation about what is missing in terms of, minerals, vitamins, or what's the balance or state of hormonal or something, just as a confirmation. But those are not, it's not going to be based on my prescription. But understanding the person is the base of, my protocol. So we go, as I said, we go to treating the person. Homeopaths do not look for disease. The same thing with integrative practitioners. So we don't make diagnosis. We don't require terminology, but the problem is that this terminology and pathological terminology is something that collectively people are relating to. So we completely understand it. I studied 2 years of pathology as a homeopath, but when it comes to my practice, I don't use that pathology. I use this, all the aspects of the case that I take. So, because the law of individualization, which is the most important law in homeopathy after like cures like, to understand the case. We don't have one medicine fix all. It doesn't work. So 10 people comes with different, one name, one terminology, they get 10 different medicine. They might get some similar, but not all of them they're getting the same, because they're not the same people. They have different mentality. They have different emotions in them. Even the pain is different in them, but the terminology is the same. They call it arthritis, but arthritis is different in different people. So homeopath understands the person with the disease to find a similar remedy to the disease, but a stronger in order to remove the disease. So I would like to just, for the last part, I would like to tell you when homeopathy works, when homeopathy doesn't work. To end my talk. So homeopathy is a brilliant system of medicine, as we all know. Removes the natural disease by creating a short-lived artificial disease. So we have a natural disease that is in the internal disease. And what do we have to do? We have to create a dynamized, short-lived artificial disease, but stronger than this natural disease. That's the art of homeopathy. You want to master your practice to have to understand what frequency you have to go in order to remove that disease. The only time you can understand the person with the totality of symptoms. So according to this principle is not only homeopathy, it's a philosophical concept. A strong force always destroys a weaker force. Even in the world, the wars happening, the stronger army is going to kill the weaker army. In jungles, the stronger animal eats up the weaker animal. The same thing within you. The stronger force, dynamized force, can remove a weaker force. So we have to create an artificial disease to remove that weaker force. So when homeopathy works and how homeopathy works with when natural disease is not suppressed. And the picture of disease is clear. So you got to listen to this carefully when the natural disease is not suppressed. So there are many times patients comes to me, they're in a hardcore, heavy medications. Some of them they're on 18. I have seen 25 different medications that they come in the bag. Some of them bring them in the suitcase. The only way that I would accept that patient is to go off that medications gradually with my protocols. If they say no, unfortunately, is not a candidate for my practice, because I have to bring the picture of natural disease back. Otherwise, I cannot. The complex disease is a picture that we don't understand it. We don't. We have to have using a rewinding mechanism, which is homeopathy, is the best rewinding mechanism to bring the complex disease back to the natural disease. There are times that the people say, no, we don't want to go on an artificial medication. I say, you're the best candidate because there's a natural disease, it's so understandable. So, but the one that they say, no, we don't want to go off artificial medications or allopathic medication. I say, oh, I'm sorry, I cannot help. It's not that I cannot help, your body is not going to help you. So homeopathy works when the natural disease has not converted to the complex disease by continuous suppressions. So in the middle of the way, we can come and help them to rewind the complex disease. When the complex disease is fixed, is beyond healing point. It's a beyond healing point. Then nobody can help. Homeopathy works when the person is not on chemical medications or are coming off, as I explained. Homeopathy works when the disease has not evolved beyond healing point, as I just said. Homeopathy works when the life force is still repairable and not deflated, because life force or life energy in the body is like a balloon that is always, it's like a balloon. And if it's deflated by anything, so it could be pathogens, it could be bad food, it could be toxication or whatever. So we can repair it with homeopathy and bring back physiology. But if it's completely deflated, it's beyond healing point. Homeopathy works when the human organs were not removed. If somebody's removed the thyroid, how can I treat the thyroid? Okay, but because of practice that I have done, I have to create the pathway of thyroid. Thyroid is no longer there, but I have to create pathway from pituitary gland to the other part of the body in order to get her off thyroid medications. Homeopathy works when physiology can be restored to homeostasis. This is something that's very obvious, and I mentioned earlier. Okay, I think I'm done.
Yes, of course. There are some questions, ma'am.
There's some what? Sorry?
There are some questions.
Questions? Okay, go ahead. Go ahead with the questions.
From Bangladesh, Shaikhul Islam, they said hello. And Dr. Angi, he said about miasm and vital force. What is the definition of miasm and vital force?
Okay. Is a homeopath was asking or a non-homeopath was asking?
Dr. Angi from Indonesia.
Oh, Rangi. Okay. Miasm. Let me simplify my education to understand. Miasms is a evolution of disease and the layers of the disease. Like, for example, from benign phase, the disease evolves from benign phase and evolves to the malignant phase, right? So when we say miasm in homeopathic language is different than a medical language. Miasm, it says, so if it's a benign miasm, we call it psora or psoric miasm, which is, normally the skin is involved. The rash and all those, so simple to understand what's going on. But when it comes to psychotic miasm or psychosis miasm, is a time actually the psora is evolved, the disease evolved to psychosis or psychotic miasm, which is asymptomatic. There's no much symptoms in the middle. Okay, we had it, Dr. Otami. I think I have I have taught this in homotoxicology with the 6 phases of disease, right? So we have 2 benign, we have 2 psychosis, like 2 psora, 2 psychosis, and 2 syphilis. So then at this miasm of psychosis, which is the asymptomatic, is a very, very hard to understand the case, but homeopath can understand it. So, and then if it's not removed or is not rewinded to the psora, the benign miasm, is going to evolve to the malignant, become syphilis. So syphilitic miasm is the most advanced or the most malignant phase of disease. These are called miasms. Okay, so to simply say it is just from benign to malignant. That's called miasms. And what was the next one? What was the next question? Unmute yourself.
About the vital force, Prof.
Vital force.
Definition.
Vital force.
I just talked about vital force, and let me just vital force is a dynamic, is a energy life or life energy that without it we are dead, right? So we call it in homeopathic language, we call it vital force. Okay, and this vital force has to run smoothly and has to run everywhere. It's not that vital force cannot be biased to go to the heart and doesn't go to the lungs. It doesn't, it goes everywhere and it has to be smooth. But when the person gets sick, the reason that gets sick, this vital force is, as is my analogy, is like a balloon, like a round balloon that, imagine your body, okay? And imagine this balloon within you. And the life energy is moving through this balloon and you can sustain life. Okay? Imagine a pathogen or anything that gets into your body is poking and hitting this life force or vital force and creating a hole. Always, any pathogens or any disease agent, we call it disease agent, that comes, it's going to poke the vital force. That's the very first thing. So what happens if you have a balloon in your hand and you poke it with a needle? What's going to happen? Either it's going to explode or it's burst, or it's going to be deflated. So it depends on the strength of that disease agent. So imagine the disease agent, because the life force is strong as well. Disease agent is causing a hole in the life force. And what happens? The energy in that balloon is going to leak out. You feel sick.
Excellent.
You don't have energy. You don't have appetite. So you feel bad. You feel pain. You feel you feel that you're not yourself because the energy of the vital force is leaking out. Now immediately you have to patch it up. You have to patch it up in order to sustain the energy within you. Otherwise, you evolve to a further, malignant phases. So what the allopathics medicine do ignores this, ignores to patch up this vital force. It just goes after your symptoms that you don't feel energy, you don't have energy, you feel you don't have appetite, you do. All the symptoms goes after that. It's not going to heal this vital force. And that disease is still going to be there, and this hole is going to get bigger and bigger and bigger. So that's a problem.
Thank you. Thank you, ma'am. And there are a lot of questions, but in Bangladesh, here is too late now, around 10 p.m. So there are another wonderful speaker. So, ma'am, could you give floor, please, then?
You already. So can you take your screen? Can you take your slides out of the screen that I can?
Okay. Okay.
Oh, so you already removed my screen.
Yes, there are other speakers. They are waiting. In Bangladesh, it's too late.
Okay, then go ahead. Yeah, go ahead. If you have guys, you have any questions? I'm here, so I can stay longer. So for me, it's just a day. And if you are in Canada or United States, you can stay. And yeah, go ahead with the next speaker. Thank you so much for listening to me. I hope that I was a little bit of help to understand that.
It's a golden opportunity for Bangladeshi people that you are exploring your institution, your educational journey, and what is the violation of the body, what is the process of detoxification. It's a wonderful journey. I think if you have, there are a lot of participants there, but most of the participants are speaking in Bangla. So I hope they will learn more. So now I think I will continue the program with Bangla, if you give permission.
Yes, go ahead, please.
And most of the participants from homeopathy and allopathic department. Now I'm giving floor to our wonderful famous doctor, allopathy doctor from PG Hospital. His name is Dr. Timir. Dr. Timir, do you hear me?
Hello.
Yes, we find her.
Yes. I hear you, brother. Am I audible?
Yes.
Am I audible?
Yes. Now your turn. First of all, you will introduce yourself and you will speak about your experience. And I think what will the language? Some people are from Bangladesh, some people are other country, Indonesia, Serbia, and Canada. I am confused, but I think Bangla and English, some are questions. So, okay, it's up to you. If you prefer to speak in English, you can deliver in English. If you prefer to speak in Bangla, this is up to you. Okay, dear Timir, now your turn. You should speak yourself. Thank you.
By the way, Dr. Ola, if you want to record, you can record it. So
yes, I'm doing it. Thank you, ma'am. There are a lot of questions.
I know. I'm just gonna read the questions, and I hope that I can. We have time to answer it, right? So go ahead with the next speakers.
Okay.
Thank you, Dr. Niamatullah. I am Dr. Timir Kumar Shaha. I have completed my MBBS from Faridpur Medical College, Bangladesh, and now I am working as a resident medical officer at Bangladesh Medical University. the former PG hospital. Today I am discussing about the pediatric infectious disease, and as there is we can call it the epidemic of infectious disease in the pediatric group of Bangladesh. And I think as most of the audience are Bangladeshi, they will be comfortable with Bangla. So I am continuing my next discussion in Bangla.
Thank you.
So তো আমাদের প্রথম যে ডিজিজটা নিয়ে আমি কথা বলছি সেটা হচ্ছে চিকেন পক্স। তো চিকেন পক্স হচ্ছে এক ধরনের ভাইরাস যেটা হার্পিস জোস্টার নামে পরিচিত, সেই ভাইরাস দিয়ে হয়। এবং এই ভাইরাসটা একটা ইন্টারেস্টিং ব্যাপার হচ্ছে, এই ভাইরাসটা আমাদের শরীরে ডরমেন্ট অবস্থায় থেকে যেতে পারে, এবং এটা যখন পরবর্তীতে আবার অ্যাক্টিভ হয় তখন এটাকে ভেরিসেলা জোস্টার বলে। তো যাই হোক, প্রথমে এই ভাইরাসটির ক্লিনিক্যাল ফিচার কি হতে পারে? এটা প্রথমত আমাদের শরীরে ব্লিস্টার বা বলা যেতে পারে ফোস্কা তৈরি করে, এবং এটা শুরু হয় আমাদের শরীরের যেটা ট্রাঙ্ক, মানে একদম আমরা যেটা বডি বলতে চাই সেই বডিতে আসে, এবং এটা সেন্টিপেটালি মানে বডি থেকে শুরু করে চারদিকে ছড়িয়ে পড়ে। মানে প্রথমে শরীরে আসবে, তারপর হাতে, পায়ে, মুখে এই ফোস্কাটা চলে আসবে। এবং এটা যেহেতু একটা খুব ইনফেকশিয়াস মানে সংক্রামক ব্যাধি, তো এবং এটা আমরা বাচ্চাদের যেহেতু নিয়ে কথা বলছি, তো এটা যখন হবে তখন বাচ্চাকে কি করতে হবে? স্কুলে যাওয়ার ক্ষেত্রে তার বিধিনিষেধ আছে। তো যতদিন না এই ব্লিস্টার গুলো ড্রাই হয়ে যাচ্ছে বা শুকিয়ে যাচ্ছে ততদিন পর্যন্ত কিন্তু বাচ্চা স্কুলে যাবে না। সাধারণত 7 দিন সময় দরকার হয়, এবং বাচ্চার সাথে যারা কন্টাক্টে আসবে তাদেরকেও কিন্তু এই সময়টা এক্সক্লুশনের দরকার আছে। এবং বাচ্চার এবং হচ্ছে আমরা জানি এটার জন্য ভ্যাকসিন দেওয়া হয়, এবং এটা 18 মাস বয়সে সাধারণত এটা MMR ভ্যাকসিনের সাথে একসাথে মিলিয়ে MMRV ভ্যাকসিন দেওয়া হয়। আর যদি কেউ ইমিউনো সাপ্রেসড থাকে, হয়তো ডায়াবেটিক বা ক্যান্সার পেশেন্ট, তাদের ক্ষেত্রে ইমিউনোগ্লোবুলিন দেওয়া হয়। আর চিকেন পক্স থেকে পরবর্তী যে জটিলতা হয় যে সেকেন্ডারি ব্যাকটেরিয়াল ইনফেকশন হয়ে যেতে পারে। আর এটার চিকিৎসা হচ্ছে সিমটোমেটিক চিকিৎসা। বেসিক্যালি যদি কেউ ইমিউনো সাপ্রেসড থাকে, শুধুমাত্র তখনই তাকে অ্যান্টিভাইরাল থেরাপি দেওয়া হয় 3 দিনের জন্য। আমরা পরবর্তী যে ডিজিজটা নিয়ে কথা বলবো সেটি মিজলস। মিজলস মূলত শুরু হয় কফ, করাইজা, কনজাংটিভাইটিস, অর্থাৎ কাশি, করাইজা হচ্ছে তার রানিং নোজ বলা যেতে পারে, আর হচ্ছে কনজাংটিভাইটিস, তার চোখ লাল হয়ে যাবে, তাই তো? তো এই 3টা ফিচার দিয়ে শুরু হবে, এবং 3 থেকে 4 দিন পরে তার একটা কপ্লিক স্পট আসবে। কপ্লিক স্পট বলতে বোঝায় তার যে মাড়ির ওখানে একটা সাদা রঙের আলসারেশন তৈরি হবে। তো এই ফিচার গুলো আসার পর পেশেন্টের বা বাচ্চার শরীরে র্যাশ আসবে, এবং এই র্যাশটা শুরু হবে মূলত কানের পেছন থেকে, তারপর মুখে, এবং তারপর সারা শরীরে চলে আসবে। তো মিজলসের কিছু কঠিন কমপ্লিকেশন রয়েছে। এটা থেকে নিউমোনিয়া হতে পারে, ডায়রিয়া হতে পারে, কানে অটাইটিস মিডিয়া হতে পারে, এবং পরবর্তীতে ব্রেনের এনকেফালাইটিস হতে পারে, যেটা SSPE বলা হয়, যে সাব অ্যাকিউট স্ক্লেরোসিং প্যান এনকেফালাইটিস হতে পারে। তো এই জন্য মিজলস নিয়ে আমরা সচেতন থাকার চেষ্টা করব, এবং এটা ম্যানেজমেন্টে মূলত ভিটামিন A সাপ্লিমেন্ট দেওয়া ছাড়া আর অন্য তেমন কিছু করার থাকে না। তো এই জন্য আমরা যে ভ্যাকসিন রয়েছে, যে MMR ভ্যাকসিন 12 মাসে এবং MMRV ভ্যাকসিন 18 মাসে, এটা আমরা বাচ্চাদেরকে দিতে উৎসাহিত করব। আর যদি কেউ আবারও ইমিউনোসাপ্রেসড অর্থাৎ ডায়াবেটিক, ক্যান্সার পেশেন্ট বা আরো অন্যান্য ক্রনিক ডিজিজ আক্রান্ত থাকে, তাদেরকে আমরা ইমিউনোগ্লোবুলিন দিব। আর এক্ষেত্রেও বাচ্চাকে কি করতে হবে? বাচ্চাকে হচ্ছে স্কুল থেকে কি করতে হবে, এক্সক্লুড করতে হবে 5 দিনের জন্য। এবং এবং যদি তার কন্ট্যাক্টে যারা আসবেন তাদেরকে ভ্যাকসিন না দেওয়া থাকে, তাহলে তাদেরকে 14 দিনের জন্য এক্সক্লুশন করতে হবে, বা যেটাকে আমরা আইসোলেশন নামে হচ্ছে খুব আমরা পরিচিত। করোনা ভাইরাসের পর থেকে, কোভিড কালের পর থেকে আমরা আইসোলেশন নামে পরিচিত। তো আমাদের পরবর্তী যে রোগটা নিয়ে আমরা বলতে চাই সেটা হচ্ছে রুবেলা। তো রুবেলার এটাও হচ্ছে একটা ভাইরাস দিয়ে হয়। তো এটার যেটা হবে যে পোস্ট অরিকুলার লিম্ফ নোড এটা ফুলে যাবে। হ্যাঁ, আমাদের কানের পেছনে যে লিম্ফ নোড গুলো আছে সেটা ফুলে যাবে, এবং তারপরে যেটা হবে কি আমাদের সারা শরীরে মুখ, গলা এবং বাকি শরীরে র্যাশ চলে আসবে। এবং এটা সাধারণত বাচ্চাদের বা সাধারণ মানুষের হলে সেরকম কোনো সমস্যা হয় না। এটার সমস্যা হচ্ছে যদি প্রেগনেন্ট মাদাররা এই রুবেলা ভাইরাসে আক্রান্ত হন, তাহলে এটা কনজেনিটাল রুবেলা সিনড্রোম নিয়ে বাচ্চা জন্মগ্রহণ করে, এবং সেই বাচ্চার হার্টের সমস্যা হয়। হ্যাঁ, প্যাটেন্ট ডাক্টাস আর্টেরিওসাস নামে একটি হার্টের অসুখ, জন্মগত অসুখ নিয়ে বাচ্চা জন্ম করে। বাচ্চা জন্মগত ক্যাটারাক্ট নিয়ে ছানি নিয়ে চোখে ছানি নিয়ে জন্মগ্রহণ করতে পারে, অথবা ডিফনেস বা সে কি হবে, বধির বাচ্চা জন্মগ্রহণ করবে। তো এই তিনটা বিষয়কে একসাথে বলা হয় যে কনজেনিটাল রুবেলা সিনড্রোম। এবং এটাও এমএমআর ভ্যাকসিন, যেটা 12 মাস এবং 18 মাসে যেটা দেওয়া হয় তার মধ্য দিয়ে প্রতিরোধ করা সম্ভব। এবং যদি এই ভাইরাস কোনো বাচ্চা আক্রান্ত হয়, তাহলে তাকে স্কুল থেকে 4 দিনের জন্য এক্সক্লুশন করতে হবে, বা যতদিন বাচ্চা সুস্থ না হয় ততদিন পর্যন্ত। এরপর আমরা বলতে পারি পার্ভো ভাইরাস নিয়ে। পার্ভো ভাইরাসকে মূলত বলা হয় একটি ফিফথ ডে ডিজিজ, অথবা ইরাইথেমা ইনফ্যান্টাম। হ্যাঁ, তো ইরাইথেমা মানে হচ্ছে লাল হয়ে যাওয়া। তো এক্ষেত্রে যেটা শুরু হয় যে বাচ্চার গাল লাল হয়ে যায়। হ্যাঁ, অনেকে বলে স্ল্যাপ চিক। হয়তো বাচ্চার মানে কারো যদি গালে কি করা হয়, স্ল্যাপ করা হয় বা চড় দেওয়া হয়, তাহলে যেরকম গালটা লাল হয়ে যাবে সেরকম স্ল্যাপ চিক থাকে। এবং সেটা তারপর এই র্যাশটা আস্তে আস্তে সারা শরীরে ছড়িয়ে পড়ে। এবং এটার যে ভালো দিক সেটা হচ্ছে যে এই র্যাশটা যখন চলে আসে তখন আর বাচ্চা ইনফেকশিয়াস থাকে না, অর্থাৎ সংক্রমণের ঝুঁকি থাকে না। তাই এক্ষেত্রে বাচ্চাকে স্কুল বন্ধ করতে হয় না। আর এটারও ভয় আছে শুধুমাত্র প্রেগনেন্ট মাদারদের ক্ষেত্রে, কারণ মা যদি পার্ভো ভাইরাস দিয়ে আক্রান্ত হন, তাহলে বাচ্চার হাইড্রোক্সপিটালিস আমরা অনেক সময় দেখতে পাই যে বাচ্চার বড় মাথা, হ্যাঁ, বড় মাথা নিয়ে অনেকে বাচ্চা জন্মগ্রহণ করে। সেটা এই পার্ভো ভাইরাস গর্ভাবস্থায় মা যদি পার্ভো ভাইরাস দ্বারা আক্রান্ত হন, তাহলে এরকম হাইড্রোক্সপিটালিস নিয়ে বাচ্চা জন্মগ্রহণ করতে পারে, অথবা মিসক্যারেজ হয়ে যেতে পারে। তো এই জন্য কোনো আমরা হচ্ছে সাধারণত টেস্টের মধ্য দিয়ে নিশ্চিত হওয়ার চেষ্টা করি, যদি মা এরকম পার্ভো ভাইরাস আক্রান্ত বাচ্চার সংস্পর্শে যায় তাহলে, এবং যদি আমরা নিশ্চিত হই যে হ্যাঁ মা আক্রান্ত হয়েছে, সেক্ষেত্রে আমরা নিয়মিত আল্ট্রাসাউন্ড মনিটরিং এর মাধ্যমে চেষ্টা করি যে হ্যাঁ বাচ্চা কি হয়তো মিসক্যারেজের সম্ভাবনা কতটুকু, বা হচ্ছে হাইড্রোক্সপিটালিস ডেভেলপ করছে কিনা। এর পরবর্তী আমরা যে রোগটা নিয়ে বলতে পারি সেটার নাম হচ্ছে রোজিওলা ইনফ্যান্টাম। এটা মূলত বাচ্চার হঠাৎ করে সিভিয়ার অনসেট অফ হাই ফিভার হবে, হয়তো 40 ডিগ্রি সেলসিয়াস তাপমাত্রা উঠে গেল, বা হচ্ছে আমরা যেটা বলি 104 ডিগ্রি ফারেনহাইট এরকম। ওয়ালাইকুম আসসালাম।
Someone interrupt. I unmute him.
ওকে, প্লিজ। এবং যেরকম হচ্ছে এরকম হাই ফিভার হয়ে যাওয়ার পর যখন জ্বরটা সাবসাইড করে যাবে, তখন বাচ্চার র্যাশ আসবে। এবং এক্ষেত্রেও ভালো, যখন র্যাশ চলে আসবে তখন আর বাচ্চা ইনফেকশিয়াস থাকবে না, আর সংক্রমণের ঝুঁকি থাকবে না। তাই এক্ষেত্রেও বাচ্চার স্কুল বন্ধ করতে হবে না। তো এবার আমরা যে রোগটি নিয়ে বলবো সেটা কি বলা যায় যে হ্যান্ড ফুট মাউথ ডিজিজ। এক্ষেত্রে বাচ্চার হাতের তালুতে, পায়ের তালুতে এবং মুখে পেইনফুল ভেসিকল বা হচ্ছে বেদনাদায়ক ফোসকা তৈরি হয়। ঠিক আছে, তো এবং এইটা যেটি হয় যে যখন এই ফোসকাটা ডিসঅ্যাপিয়ার করবে বা ড্রাই হয়ে যাবে, তখন আর বাচ্চাটার তখন পর্যন্ত বাচ্চাকে স্কুল বন্ধ রাখতে হবে। হ্যাঁ, আর এটার যে চিকিৎসা, এটা চিকিৎসা মূলত সিমটোমেটিক চিকিৎসা, এবং হচ্ছে এক্ষেত্রে খেয়াল রাখতে হবে বাচ্চার যেহেতু মুখে আলসার হয়ে যায়, বাচ্চার ডিহাইড্রেশনের ঝুঁকি থাকে। হ্যাঁ, বাচ্চা পানি খেতে চায় না, হাইড্রেশনটা ঠিক মতো মেনটেন করতে হবে। আর আমরা আর দুইটি রোগ দিয়ে বলে শেষ করব। একটি হচ্ছে ইমপেটিগো। অনেক সময় দেখা যায় বাচ্চার মুখের দিকে কি হানি ক্রাস্টেড লেশন, মানে একটা সোনালী কালারের অনেকগুলো বোটার মতো তৈরি হয়ে যায়। তো এক্ষেত্রে খুব সহজ আসলে চিকিৎসা, যে আমরা হচ্ছে যদি এটা অল্প হয় তাহলে হচ্ছে মিউপিরোসিন নামে হচ্ছে আমরা অয়েন্টমেন্ট ব্যবহার করব, আর যদি অনেক বেশি হয় তাহলে আমরা ফ্লুকক্সিসিলিন বা অ্যান্টিবায়োটিক হচ্ছে 10 দিনের জন্য ব্যবহার করব। এবং এটার ও চিকিৎসা শুরু হওয়ার একদিনের মধ্যেই বাচ্চা আবার স্কুলে যেতে পারবে। আর লাস্ট আমরা যে রোগটা নিয়ে বলবো সেটার নাম হচ্ছে পার্টুসিস বা হুপিং কফ। এটা মূলত হচ্ছে কাশি এবং রানিং নোজ করাই যায়, 1 সপ্তাহের জন্য থাকে। তারপর এই কাশিটা বেড়ে যায়, এবং বেড়ে যায় এরকম যে সেটা ভালো হতে চায় না, বাড়ছে কমছে। এটাকে অনেক সময় বলা হয় 100 days of cough, যে এটা কন্টিনিউয়াসলি চলছে। তো আমরা এটা ডায়াগনোসিসটা করব যে তার ন্যাজোফ্যারিংস থেকে আমরা সোয়াব নিয়ে পিসিআর করলে এটা ডায়াগনোসিস করা সম্ভব। এবং এটার সব থেকে মারাত্মক যে বিষয়টি হচ্ছে, এটা পরবর্তীতে নিউমোনিয়া হয়ে বাচ্চা মারা যেতে পারে। তো এটার চিকিৎসাও খুব সহজ, আমরা অ্যাজিথ্রোমাইসিন 5 দিনের জন্য দিলেই হয়ে যাবে। আর বাচ্চার হসপিটালাইজেশন প্রয়োজন হতে পারে যদি বাচ্চার বয়স 6 মাসেরও কম হয়, এবং বাচ্চার যদি তার সাথে কমপ্লিকেশন থাকে, যেরকম অ্যাপনিয়া, মানে সে শ্বাস নিতে পারছে না, সায়ানোসিস, হাত পা নীল হয়ে যাচ্ছে, এবং নিউমোনিয়া হয়, এবং এনকেফালোপ্যাথি হয়, হয়তো বাচ্চার জ্বরের সাথে সাথে খিঁচুনি হচ্ছে। এবং এক্ষেত্রে যেটা আরেকটি গুরুত্বপূর্ণ বিষয়, যে প্রেগনেন্ট মাদারদের যদি তারা যদি এরকম তারা যেন এই পার্টোসিস বা হুপিং কফে আক্রান্ত না হন, এই জন্য তার গর্ভের অবস্থায় 20 সপ্তাহ থেকে 32 সপ্তাহের মধ্যে রুটিনলি তাকে ভ্যাকসিন দেওয়া হয়। এবং ন্যাশনাল ইমিউনাইজেশন যে প্রোগ্রাম আছে আমাদের, সেখানে প্রতিটি বাচ্চাকে 2, 4, 6 মাসে এবং তাকে এই রোগের ভ্যাকসিন দেওয়া হয়। ডিপিটি ভ্যাকসিন নামে যেটা দেওয়া হয়, সেটার ভেতরে এই পিটা হলো পার্টোসিসের ভ্যাকসিন। তো ধন্যবাদ সবাইকে, সবাই মনোযোগ দিয়ে শুনেছেন। থ্যাংক ইউ। নিয়ামতুল্লাহ ভাইয়া। ডক্টর নিয়ামতুল্লাহ।
Something happened in my laptop. So, dear Angi, could you continue?
আমি ল্যাপটপ দিয়ে কথা বলছি।
No, my laptop is hang. Technical issue. So, dear another host, dear Angi from Indonesia, do you hear me? Could you continue the next speaker? Hello. Our next speaker is Dr. Anuraj Bishwas. He will continue his topic.
Hello. Excuse me. Now technical issue is removed. Thank you, dear Timir Bhai. Do you hear me?
হ্যাঁ।
Okay, now my technical issue is removed.
শুনতে পাচ্ছি। Yes.
Thank you.
I'm hearing you, brother.
You wonderfully explain about the virus disease, that is measles and other disease, infectious disease, how we will manage it, and what is the medicine. Is there any question about his speech? Hello? Okay, I think there are a lot of people from Bangladesh and Serbia, Indonesia, also Canada. So they are all a learner. Some are doctor, some are doing practice in homeopathy. So they are wonderfully understand about this topic. আমি মনে হয় একটু বাংলা বললে ভালো হবে। ভাইয়াকে অনেক ধন্যবাদ আমাদের সাথে আমাদের এই প্রোগ্রামে থাকার জন্য। থ্যাংক ইউ ভাইয়া, আপনার
Most welcome.
মূল্যবান সময় দেওয়ার জন্য।
Okay.
আর আপনাদের কোনো প্রশ্ন থাকলে বাংলায় করতে পারছেন। হ্যাঁ, ভাইয়া হচ্ছে পিজি হসপিটালের রেসিডেন্ট ডক্টর এবং আমাদের খুবই আন্তরিক একজন ফেমাস ডাক্তার বাংলাদেশের। আর কোনো কোশ্চেন থাকলে করতে পারছেন। আদারওয়াইজ আমরা নেক্সট স্পিকারের কাছে যাব। থ্যাংক ইউ ভাইয়া।
Oh, thank you for your nice cooperation, and I am also very grateful that you have give me the opportunity to present today.
Yes, there are you found there Anggi was MBBS doctor from Indonesia, and there are also
Okay.
Serbia MBBS doctor, the Vesna, and Canada doctor Dr. Parvin Jarin, and lot of allopathy doctor also participated. So thank you from my perspective, and we will go our next speaker. Until then, bye bye.
Oh, okay, bye. Always welcome.
Thank you, dear. Now I will give floor to our honorable speaker, Dr. Anwar H. Bishas. Do you hear me, dear Anwar H. Bishas? He is from Government Homeopathy College, Mirpur. He is in charge of community department. Do you hear me? Do you unmute?
Yes. Assalamu alaikum.
Walaikum assalam.
Thank you. I am from Bangladesh. I am Dr. Anwar H. Bishas, Department of Community Medicine in charge. One of the Government Homeopathic Medical College, Mirpur 14, Bhatin, Dhaka. Now I discussed about animal lives and work. You know, today is 11th April, Animal's birthday and World Homeopathy Day. So my speech is life and work of Dr. Samuel Hahnemann. Distinguished chair, honorable speakers, respected colleagues and participants from around the world. Assalamu alaikum, and very warm greeting to you all. Today we are not just celebrating a birth anniversary. We are honoring a revolution in medical science. We are remembering a man whose vision transformed suffering into hope and uncertainty into a scientific system of healing. Dr. Samuel Hahnemann, born in 1755 in Mission, Germany. Hahnemann was a man far ahead of his time. He was a physician, chemist, and linguist, but above all, he was a humanitarian. At a time when medicine was dominated by aggressive and often harmful practice like bartering and toxic drugging, Hahnemann dared to question the status quo. His questions did not allow him to accept a system that harm patients guided by the principles of do no harm. He stepped away from conventional practice and began searching for a safer, more national method of treatment. This search led to a holistic breakthrough. While translating a medical book, he concluded a experiment on himself using cinchona bark. He observed that it produced symptoms similar to malaria. From this simple yet profound observation, he formulated the eternal law of healing, similia similibus curenter, like cures like. This was the birth of homeopathy, a system based not suppression but on stimulation of the body's own healing power. But Hahnemann contribution do not stop a single practice. He introduced drug proving a scientific method to testing medicines on healthy individuals to understand their full range of effects. He developed the concept of potentization, transferring crude substance into gentle yet powerful remedies through dilution and succussion. His masteries, the organon of medicine, stands even today as a guiding light for practitioners across the globe. In it, the emphasis individualized treatment, treating not just the disease but the person as a whole, mind, body, and spirit. Throughout his life, Hahnemann faced criticism, opposition, and deep compassion for humanity kept him steadfast on his path. But today, more than 2 centuries later, his legacy is alive and thriving. Homeopathy has crossed all borders, geographical, cultural, and intellectual, bringing gentle and holistic healing to millions. As practitioners, teachers, students, researchers were the custodians of his legacy. Our responsibility is not only to practice homeopathy, but to preserve its purity, to strengthen its scientific foundations, and to carry it forward with honesty and dedication. On this World Homeopathy Day, let us make a promise to uphold the truth he discovered, to practice with composition, and to dedicate ourselves to the service of humanity, because human did not just give us a system on medicine. He gave up as a philosophy of healing. Let us honor him not only with words, but through our actions. Thank you all of our kind attention. আমি বাংলাতে একটু কথা বলতে চাই এ বিষয়ে। যেহেতু একটা ইন্টারন্যাশনাল প্রোগ্রাম, আমি স্পিচটা ইংলিশে একটু থ্রো করলাম। তো সারমর্ম হচ্ছে, আমরা আজকে হ্যানিম্যানের জন্মদিন বা ওয়ার্ল্ড হোমিওপ্যাথি ডে not only focus his life and work, but when we are not applicable this system on my chamber, on my practice, যদি আমি আমার প্র্যাকটিসে হ্যানিম্যানের আদর্শকে বাস্তবায়ন না করি, যদি আমি প্র্যাকটিস ওইভাবে না করি, যদি আমি মানবিক না হতে পারি, যদি আমি টোটাল ফিটনেসকে গুরুত্ব না দিই, ফিজিক্যাল ফিটনেস, মেন্টাল ফিটনেস, সোশ্যাল ফিটনেস অ্যান্ড স্পিরিচুয়াল ফিটনেস, মানুষের শারীরিক, মানসিক, সামাজিক এবং আত্মিক সুস্থতা যদি আমি ফিরাই দিতে না পারি, তাহলে অ্যানিমেনিয়ান চিকিৎসা হবে না। এবং টোটাল ফিটনেস বা হেলথের যে ডেফিনিশন, ওয়ার্ল্ড হেলথের ডেফিনিশন অনুসারে ফিজিক্যাল, মেন্টাল অ্যান্ড সোশ্যাল, স্পিরিচুয়াল ওয়েলবিং, নট ফেয়ারলি অ্যাবসেন্স অফ ডিজিজ। এই জন্য আমাদেরকে হ্যানিম্যানের যে ফিলোসফি অফ হ্যানিম্যান, অর্গানন অফ মেডিসিন, ম্যাট্রিমেডিকা, সকল ধরনের জ্ঞান আমাদেরকে আয়ত্ত করতে হবে। তার মাধ্যমেই আমরা সত্যিকারের আজকের এই যে দিবস পালন, ওয়ার্ল্ড হোমিওপ্যাথি ডে অর লাইফ অ্যান্ড ওয়ার্কস অফ হ্যানিম্যান, এটা বাস্তবায়ন হবে যখন আমি মানবিকভাবে হিউম্যান রাইটসকে যদি আমি সম্মান করতে পারি, তাহলেই। এবং দারিদ্র এবং যারা বিভিন্ন চিকিৎসাতে, অপচিকিৎসায় বিভিন্ন ধরনের ক্রাইমের শিকার হয়েছে, সেই সব রোগীগুলাকে যদি সত্যিকারের অর্থে বেস্ট হোমিওপ্যাথি ট্রিটমেন্ট আমরা দিতে পারি, আইডিয়াল হোমিওপ্যাথি দিতে পারি, তার মাধ্যমেই আজকের এই দিবস পালন সুন্দর হবে এবং এটা বাস্তবায়ন হবে। ওয়ার্ল্ড হোমিওপ্যাথি ডে লং লিভ হবে যদি আমরা আমাদের কার্যে হ্যানিম্যান এবং তার ফিলোসফি এবং তার যে ল অফ কিওর এবং অর্গানন অফ মেডিসিন, ল অফ হোমিওপ্যাথি, এটা আমাদেরকে পারফেক্টলি কন্টিনিউ করতে হবে এবং পারফেক্টলি মেনটেন করতে হবে। তার মাধ্যমে আমাদের আজকের এই ওয়ার্ল্ড হোমিওপ্যাথি ডে এবং আমাদের হ্যানিম্যানের জন্মদিন, হ্যানিম্যান বেঁচে থাকবে আরো হাজার হাজার বছর, নট অনলি 2th century or 4th century, 1000th century, যদি আমরা সত্যিকার এভাবে গড়ে তুলতে পারি। তো আজকে আমাদের বাংলাদেশের পক্ষ থেকে যারা আমাদের গেস্ট আছেন তাদেরকে আমি সাধুবাদ জানাই। অনেক বেশি হয়তো বা আজকে আমাদের হয়তো রাত 10টা, অনেকের হয়তো সকাল, অনেকের হয়তো ঘুম নষ্ট করে আমাদের প্রোগ্রামে যোগদান করছে। এজন্য আমি সবাইকে ধন্যবাদ জানাই এবং বাংলাদেশে এবং বাংলাদেশের প্রতিবেশী দেশ যারা যুক্ত আছেন সবাইকে আমি সাধুবাদ জানাই। আর সবচেয়ে আমি বেশি থ্যাঙ্কস জানাই নিয়ামতুল্লাহ, যে অক্লান্ত পরিশ্রম করেন এইসব বিষয়গুলো এবং আমাদের দেশটাকে রিপ্রেজেন্ট করছে ওয়ার্ল্ডের কাছে। আমি মনে করি নিয়ামতুল্লাহ থ্যাঙ্কস না, শুধু আমার ভালোবাসা এবং আমার আদর, ভালোবাসা সবকিছুই থাকলো। নিয়ামতুল্লাহ, আপনি এগিয়ে যাবেন এবং আমাকে কথা বলার যে সুযোগ দিয়েছেন এই জন্য আমি আন্তরিকভাবে ধন্যবাদ জানাই। আমি যদিও খুব টায়ার্ড, নাইটে এসেছি, আবার সারাদিন অফিস করে চেম্বার করে আপনাদের সাথে যোগ দিতে পেরেছি, শুকর আলহামদুলিল্লাহ। থ্যাঙ্কস অল।
Dear, could you introduce yourself and could you explain this last ending word in English, because most of the participant, Dr. Parveen Jain ma'am, Dr. Angi, and most of the participants they are don't in Bangla. So could you deliver your ending word in English?
Oh yes. I am, I am Dr. Anwaris Bistas. I am BSMS from Dhaka University. I am Masters of Public Health, another university. I am completed clinical social work, Masters in clinical social work, and now recently I started MPhil program, Dhaka University. I am a government worker and I am a in charge my department, community medicine. Ending session on this World Homeopathy Day, we work together and we work standard times and homeopathy, and we continue lawful practice and must be a human rights continue my practice and all over the world. Thank you all. Thank you.
there is only one government homeopathic college in Bangladesh, and he
Yes,
is
yes.
in charge of his department. So why you not say about this thing? And he's really famous in Bangladesh. Thank you, dear. Thank you from my heart that you give a wonderful
Thanks.
speech.
Thank you.
Thank you for everything. Is there anybody?
Thank you.
Do you have any question? কার কোনো প্রশ্ন আছে? আনমিউট করে বলতে পারেন। না হলে we will go to our next speaker and he will deliver in his speak in Bangla. So I hope there is no question because everybody know about homeopathy and Hahnemann. So now I will give floor to our next speaker. Thank you, dear. Thank you. Bye bye. Assalamu alaikum.
I convey my salam, Professor Parveen Jerin. She is the most popular speaker I know. Thanks for introducing me, Niamatullah. Thanks, Professor Parveen Jerin. Thank you.
Okay. Now I will give floor to our next speaker. Dear Dr. Abdul Kabir, do you hear me?
প্রধান উদ্যোক্তা ডাক্তার নিয়ামতুল্লাহ, আমার স্নেহাশিস, আমার শ্রদ্ধেয় ডাক্তার, আমার শিক্ষাগুরু, উনিও শিক্ষাগুরু ডাক্তার আব্দুল মুতালিব মিয়া, ডাক্তার মোহাম্মদ মুতালিব মিয়া প্রয়াত স্যার, ইনিকে আল্লাহ জান্নাত নসিব করেন। আমি যার কাছ থেকে আমি হোমিওপ্যাথিক 2-4টি কথা শিখেছি এবং এই শিক্ষার উপর আলোচনা করে থাকি। মহাত্মা ডক্টর ভিত্তিক চিকিৎসার আবিষ্কারক, এর 271তম জন্মবার্ষিকী, জন্মদিন শুভ হোক। আরো কামনা করি এই মহাপুরুষের চিকিৎসা নীতিকে তারই ধারাবাহিকতায় এগিয়ে নিলে প্রাণী এবং মানব স্বাস্থ্য বর্তমান ক্ষতিগ্রস্ত অবস্থা থেকে মুক্তি পাবে বলে আমি বিশ্বাস রাখি। কিন্তু আমি আতঙ্কিত এই ভেবে যে অনেক হোমিওপ্যাথিক চিকিৎসক একক ঔষধ নির্বাচন, সূক্ষ্ম মাত্রা এবং সদৃশ্য নীতি পরিহার করেন হ্যানিম্যানের আদর্শকে পাশ কাটিয়ে ভালো হোমিওপ্যাথ চিকিৎসার পথ খুঁজতেছেন। তাদের বলবো, ফিরে আসুন হ্যানিম্যানের আদর্শে। আসুন আমরা স্থূল মাত্রার মেডিসিন থেকে সূক্ষ্ম মাত্রায় চলে আসি। প্রফেসর ডাক্তার পারভিন জেরিন অত্যন্ত সুন্দরভাবে আলোচনা করেছেন, বিশেষ করে আর্টিফিশিয়াল ডিজিজ এবং ন্যাচারাল ডিজিজের উপরে ওনার বক্তব্য শুনেছি এবং খুব ভালো লেগেছে। উনি ন্যাশনাল ডিজিজ এবং আর্টিফিশিয়াল ডিজিজের উপর সুন্দর আলোচনা করেছেন। আমরা অতি সুন্দর একটা প্রশ্নের উত্তরও পেয়েছি। বিশেষ করে ফোর্স এবং মায়াজমের পার্থক্যটাকে উনি সুন্দরভাবে বুঝিয়েছেন। যারা অত্যন্ত হোমিও ভাষা চঞ্চল এবং ভাষাবিদ তারা ভালোভাবে বুঝবেন। আমার মতো অল্প হোমিওপ্যাথিক শিক্ষিত এটা ভালোভাবে বোঝার সবই কম আছে। তবে আমি বিশ্বাস করি আজকের এই আলোচনার মাধ্যমে ওয়ার্ল্ড ওয়াইড পৃথিবীর প্রান্তর টু প্রান্তরে ডাক্তার নিয়ামতুল্লাহ হোমিওপ্যাথিক এবং হোমিওপ্যাথিক আদর্শ এবং হোমিওপ্যাথিকের বাস্তবায়ন এই সম্পর্কিত অতি উত্তম একটা অনুষ্ঠান পরিচালনা করে হোমিওপ্যাথিককে অনেক অগ্রগামী করেছেন। ভাষায় আমরা যদিও বাংলাদেশি, অল্প স্বল্প ইংলিশ বুঝি, কিন্তু ইংলিশে তার উত্তর দিতে পারি না বিদায় অনেক কিছুই বলতে পারিনি, অনেক প্রশ্ন রয়ে গেছে। আমাদের ডাক্তার আনোয়ার হুসেন বিশ্বাস, আজকে আমাদের ডাক্তার তিমির কুমার শাহ, ওনারা হোমিওপ্যাথিক এবং অ্যালোপ্যাথিকের বিভিন্ন ভার্সনের কথা বলে থাকেন। গভর্নমেন্ট নিয়ন্ত্রিত হোমিওপ্যাথিকের সাথে ওনারা সম্পৃক্ত আছেন এবং অ্যালোপ্যাথিক ফাংশনে ওনারা ক্রিয়া করে থাকেন, চিকিৎসা সেবা দিয়ে থাকেন ওনাদের মাধ্যমে। এবং ডাক্তার পারভিন জেরিনের মাধ্যমে বিশ্ববাসীকে আমি আমার একটি মেসেজ দিতে চাই। বিশেষ করে বাংলাদেশ গভর্নমেন্টকে আমি একটা মেসেজ দিতে চাই। আমাদের বর্তমান বাংলাদেশে আতঙ্কিত মহামারী হামের চিকিৎসা এবং পরিত্রাণের উপায় অনুযায়ী বাংলাদেশ গভর্নমেন্ট অত্যন্ত ব্যয়বহুল টিকা ব্যবস্থা বা ভ্যাকসিনের ব্যবস্থা করেছেন বটে। তার পাশাপাশি যদি আমাদের মরবিলিনাম দিয়ে আমাদেরকে সরকারিভাবে কোনো সুযোগ দেওয়া হতো, তাহলে আমরা গ্রামে গঞ্জে ঘুরে ঘুরে মানুষকে আমাদের প্রতিষেধকটা প্রয়োগ করে দিতে পারতাম এবং অতি অল্প খরচে আমাদের দেশে মহামারী থেকে অনেক মানুষ মুক্তি পেত। আমি বিশ্বাস রাখি আমরা করোনাকালীন সময়ে যেইভাবে দেশের কাজে ঝাঁপিয়ে পড়েছিলাম, বাংলাদেশ পুলিশ ডিপার্টমেন্ট থেকে তৎকালীন এআইজি রেবেকা সুলতানাকে দিয়ে আমরা পরিপত্র জারি করে সারা বাংলাদেশে যেভাবে লক্ষণ ভিত্তিক চিকিৎসা এবং হোমিও বুস্টার দিয়ে করোনাকালীন সময়ে সুন্দরভাবে চিকিৎসা পরিচালনা করেছি। বিশেষ করে সামনে থেকে তারা করোনাকালীন সময়ে ডিউটি পালন করেছে, পুলিশ ডিপার্টমেন্টকে না বললেই না হয়, তাদেরকে সাধুবাদ জানাতে চাই। এবং অনেক পুলিশ ডিপার্টমেন্টের অনেক বড় বড় অফিসাররা আমার অফিস থেকে হোমিওপ্যাথিক বুস্টার গ্রহণ করেছেন। সেইভাবে যদি আমাদেরকে এই মহামারীকালীন সময়ে বাংলাদেশ স্বাস্থ্য সেবা যারা নিয়ন্ত্রণ করেন তারা যদি আমাদেরকে সুযোগ করে দেন, আমাদেরকে যদি একটু স্বীকৃতি দেন, তাহলে আমরা গ্রামে গঞ্জে ঘুরে ঘুরে যেভাবে ওইভাবে আমরা অনুমতি পেলে বাংলাদেশের প্রত্যন্ত অঞ্চলে ঘুরে ঘুরে আমরা হামের প্রতিষেধক খাওয়াইতে পারতাম। যদি আমাদের এই বক্তব্য তাদের কর্ণ পর্যন্ত পৌঁছে, তবে আশা করি আমাদেরকে একটা সুযোগ দিবেন এবং আমরা এই কাজটা করার জন্য সম্পূর্ণ প্রস্তুত আছি। আমরা গভর্নমেন্টের কাছ থেকে কোনো প্রতিষেধক গ্রহণ করতে হবে না, কোনো অর্থ গ্রহণ করতে হবে না, কিন্তু আমরা হোমিওপ্যাথিকের মরবিলিনাম প্রতিষেধকটি আমরা প্রত্যন্ত অঞ্চল থেকে সিটি পর্যন্ত সমগ্র ইনশাআল্লাহ জাইতুন শাহজুদ্দিন ফাউন্ডেশন, মুতালিফ ফাউন্ডেশন, মুতালিফ অল্টারনেটিভ হোমিও ক্যান্সার সেবালয় এবং অন্যান্য হোমিও সেবা সংস্থা থেকে আমরা এই অবস্থা নিয়ে বলতে চাই, দায়িত্ব নিয়ে বলতে চাই, আমরা হোমিও প্রতিষেধক ঘরে ঘরে পৌঁছাই দিতে সক্ষম হবো ইনশাল্লাহ। তবে গভর্নমেন্টের একটু আন্তরিকতা এবং সুযোগ দেওয়া আমাদের প্রয়োজন বলে মনে করি। যারা স্বাস্থ্য সেবার সাথে জড়িত তারা যদি আমাদেরকে এইটুকু করে দেন, স্বাস্থ্য কর্মকর্তাদের বলি, স্বাস্থ্য মন্ত্রণালয়কে বলি এবং প্রশাসনকে বলি, স্বাস্থ্য প্রশাসনের যারা আছেন আমাদেরকে যদি অনুমোদন প্রদান করে দেন, যদি আমাদের পরিপত্র জারি করে দেন, আমরা সারা বাংলাদেশে হামের টিকা হোমিওপ্যাথিকে যা আছে মরবিলিনাম নিয়ে আমরা মাঠে নেমে কাজ করতে পারি এবং প্রত্যেকের ঘরে ঘরে পৌঁছে দিতে সক্ষম ইনশাল্লাহ। যদি হোমিওপ্যাথিক শাস্ত্রে যাকে অবশ্যই আমরা লক্ষণ ভিত্তিক চিকিৎসা করে যাব, লক্ষণ সদৃশ ঔষধ নির্বাচন করব, আর যাদের এখনই হাম হয়নি, হাম হওয়ার অপেক্ষায়, তাদেরকে আমরা হোমিওপ্যাথিকের প্রতিষেধক ঢালাও ভাবে আমরা ওটা প্রয়োগ করতে পারবো ইনশাল্লাহ। আমি একটি অত্যন্ত ঝুঁকিপূর্ণ এবং সংক্রামক ব্যাধি হাসি কাশির মাধ্যমে ছড়ায় হাম ভাইরাসটি ন্যূনতম 2 ঘন্টা বাতাসে ভেসে বেড়ায় এবং জীবিত থাকে। একজন হাসি কাশি দিলেই আরেকজনের মধ্যে সংক্রমিত হতে পারে, এই জন্যই দ্রুত সংক্রমিত হয়ে মহামারী আকার ধারণ করে। আর এই মহামারীর থেকে মুক্তি পাইতে হলে হোমিওপ্যাথিককে একটু সুযোগ দেওয়ার জন্য আবেদন করে রাখলাম। যদি সুযোগ পাই, কোনো না কোনো ভাবে যদি সুযোগ করে দেওয়া হয়, তাহলে আমরা বিনা অর্থায়নে আমরা স্বেচ্ছাসেবী হিসাবে হোমিও চিকিৎসকগণ মিলে মিশে আমরা দায়িত্ব পালন করে দেশ দেশান্তরে, গ্রাম অঞ্চলে এবং শহর অঞ্চলে তা প্রয়োগ করতে পারবো ইনশাল্লাহ। আমি ডাক্তার আমাদের সাথে যারা অংশগ্রহণ করেছেন তাদের প্রত্যেকেই ধন্যবাদ জানাই। আমি ক্ষমা চাচ্ছি, আমার যান্ত্রিক ত্রুটির কারণে আমি মূল পর্বে অংশগ্রহণ করতে পারিনি। আমি ধন্যবাদ জানাচ্ছি ডাক্তার পারভিন জেরিনকে, যিনি প্রফেসরের দায়িত্ব পালন করে থাকেন এবং উনি একটি বায়ু কোয়ান্টাম একাডেমি পরিচালনা করে থাকেন। উনি সুদূর কানাডা থেকে আমাদের সাথে লম্বা সময় আলোচনা করে আমাদের শ্রোতাদেরকে ধন্য করেছেন। আরো যারা আমাদের সাথে অংশগ্রহণ করেছেন সবাইকে ধন্যবাদ। বিশেষ করে এমন সুন্দর একটি অনুষ্ঠান পরিচালনা করার জন্য স্নেহাশিস ডাক্তার নিয়ামতুল্লাহকে অসংখ্য ধন্যবাদ। সবাই ভালো থাকুন। অতি রাত্র হয়ে গেছে, আরো অনেক কিছু বলার ছিল। ধন্যবাদ সবাইকে। আসসালামু আলাইকুম ওয়া রাহমাতুল্লাহ।
শুকর আলহামদুলিল্লাহ।
So I will give Dr. Besna. Then
Okay.
when my uncle's technical issue will remove, and I will give him.
I'm Vesna Marinkovic from Serbia. I'm only homeopathic doctor, specialist for homeopathic medicine, without degree of classic medical faculty. I started to learning homeopathy after very hard problems with allopathic medicine, because my health was very difficult from my born, and I had anemia, thalassemia media. Now I haven't. Thanks for homeopathy. Thanks for Dr. Hahnemann. Thanks for all homeopathic doctors of the world who work very hard to show what is homeopathy medicine, what can to do, can everything. I trust that homeopathic medicine can to help for more genetic disorder, because I was patient from 5 genetic disorders. One doctor from India helped me from 5 years ago. All time I'm on therapy, and I'm 90% better. Because he treat me, not my disease, but the disease going to be better. I start to study in my 57 years, and in first time I was study 5 years, then study academy from Professor George Vitulkas, 2 years, and after that 3 years from Professor Ton Jansen from Holland, human chemistry, because more of them is to me very interesting to learn. I'm patient who like to learn and like to share knowledge of homeopathic medicine. I haven't more patient in Serbia, because in Serbia is very difficult. We have two association for homeopathic medicine and haven't homeopathic faculty organization of inside of association comes professor from all world, from India, from England, from Deutschland, from Denmark, from Italy, and we're learning on this way. There is not agree too much for homeopathic medicine. People haven't respect doctors also haven't respect homeopathic medicine, talking it is placebo, it do nothing, but I can to show my result do everything good in genetic disorder, not only in like palliative medicine or in other sides. In Serbia, we have a problem with working homeopathic medicine. Government not wants to help doctor allopathic medicine try to stop homeopathic medicine on always talking that is not good, that is only speaking about, but haven't result. Because that I'm working online in India, on this way, because I haven't more patient in Serbia. Also, I working on Facebook, help many others, doctors, young doctors, because I know what is problem in start of working with many homeopathic doctors from Bangladesh, Pakistan, India on start to find books, to find some lessons to learn about some remedies or on rare disease. And I think homeopathy medicine have big in futures, can do everything. I want to thank Dr. Zarin for her very good description, because we have a big joys to help all world, because homeopathy working for people, for animals, for plants, and in future can to help to people living more better, because not be poisoned from herbicides, pesticides, from antibiotics, from corticosteroids, from animal products. I saw in Deutschland one farm with more cows who have only homeopathic treatment. Maybe 3% only veterinarians products, pharmacy, and this food is very good for people, because we eat in milk, we eat antibiotics and corticosteroids, but not know about. Also, homeopathy can to help for many other treat of emulgators, which is more in today products, emulgators from some algae then can to make inflammations in bowels, to have more allergy and to disturb bacterial in bowels. Then also we have other chemotherapy who can to clean body from poisons and help to Alzheimer's disease, to dementia, to many other health problems. That's.
Thank you. Do you want to continue, dear? Dear, do you hear me?
I am finished.
Thank you, Dr. Vesna. It's great to meet you here.
Thank you. And I want to congratulation for all homeopathic doctors and to thankful for this meeting.
Thank you. Thank you. We love Serbian doctor because it's near of Russia. It's the other part of our country.
Not good, sorry. I start to learn English in 57 years and start to learn homeopathy in 57 years and start to work on radar in 57 years. Too much for my years. Now in the end of April, I can to have 73 years and learning every day.
More senior.
No, homeopathy haven't end, never end, new and new. And in one moment I want to be living to learn all in homeopathy. I must living 3 times to learn everything, but it is not impossible.
Yeah, we are life students, so we learn every day.
Better from learning, you know. Remedy. All is better from learning. But I all my life like to reading because my health wasn't good and I haven't other choice. I must to be inside in house because I have more problem from sun. I haven't good pigmentation. I'm albino person also, and with this anemia, thalassemia, media, it wasn't possible to going inside on sun on hot temperature, and I haven't anything else than reading reading books.
That's a good compensation. So that's great.
and my imagination working better because I was more reading. More reading, and this if you reading, it is very, very good for men to reading. If you reading, you must to make imagination in your mind. I grow up in time without television, without films, without imagination. Must create imagination, and now it helped me to working. because I more reading. I understand about different culture, about different religion, about everything, because I want to know about people, what they doing, what they want, how they living, what is his health problems. All my life I was in homeopathy, inside homeopathy, but in the end I sit to learning. That's my truth, my journey. Goodbye for all.
Is it done, Dr. Ola? Because you said 2 hours, or
Yes. This is our last participant, my father's friend, Dr. Abdul Kabir, and he is the most senior in Bangladesh. Thank you, dear Vesna from Serbia. Now we are waiting for your speech, and we are enjoy because 20 years to 73 years, all types of ages, I can participate there, and this is only for homeopathy is possible. So I am the second generation and you are the first generation. So I hope homeopathy will be the main medicine within soon, because in my country 79 to more than 90% antibiotic is not working. Most of the antibiotic is resistant to our patient's body. So what will do? So they must be returned to solution. Solution is only homeopathy medicine. So I hope it will be a great opportunity. So now I will go to, is there any question about Serbia's homeopathy? How was the practice? Is there any question? I think I will share something. There's another speaker from Netherlands, but he gives some recorded video which will publish on my YouTube. His name is Dr. Dorothy Floren, but his time is too late, so that's why he can't join with us. I'm showing you the speaker. Our keynote speaker we complete from Dr. Parvin Jerin. Thank you, dear. And another Dr. Anwar H. Bishas from our government homeopathic college. You know, in Bangladesh, only one government homeopathic college. Because government is no participant about homeopathy. But this is the only one government homeopathic college. They are every year 50 students take admission. So he is the in charge of his department. Another, our first allopathic government hospital, that is Bangladesh University, and he is the Dr. Timir. He is the really renowned and experienced allopathic doctor. Another speaker was Dr. Dorothy Floren. She was from Netherlands, but the time is really too late, so that's why we got a recorded video, and that's published on my YouTube. If you go my YouTube, there you will find his 15-minute recorded video. Another, our senior speaker, Dr. Abdul Kabir. Now I am trying to give him floor. He is most senior in Bangladesh. He is my father's friend and doing a lot of free camping. I hope we can join with him. That's our speaker, and I am from Bangladesh. I am second generation of homeopathy. I completed my homeopathy. I try to do something. I do everything for homeopathy. To ending part, I want to say one thing, that is homeopathy, not allopathy. First of all, a person, how he will heal. Okay. There is a lot of system: homeopathy, Unani, Ayurveda, yoga, meditation, osteopathy, acupuncture, more than 90 alternative system that heal a body. But I think not we will give solution for his or his body. Body is not first priority. Priority his mind, his soul, his brain, his thinking. Okay, if he will feel negative thinking, he can got anxiety, he can got high pressure, he can got any types of stroke. So first of all, we should heal his mind, then body. Okay, that's called mind, body, and soul. In our second number 2 aphorism, we found that there is wonderful health. So I hope homeopathy is the only one way. Now in my country, what I am doing, I am only neutral because most of the patients are come with antibiotic resistant. I am giving his neutral medicine, only soric medicine. I am giving him neutral. I am giving him detoxification. I am balancing his hormonal level. Then he's okay. That's called MPTCare Protocol. This is my father's thinking that we should neutral somebody. In 5 diseases: cancer, high pressure, heart disease, stroke, and diabetes. These 5 diseases are artificial disease. Okay, so if you maintain lifestyle, if you don't take chemical drug, if you will maintain wonderful meditation, yoga, or his mind will be clear, don't give any negative thing. So it can be really easy to heal. I think when he got hormonal imbalance, then disease will become. So it can really easy to give normal level by using homeopathic medicine. So most of the women's, when they are come, their menstruation is irregular because they are giving a lot of pills, birth pill, contraceptive pill. So they don't want more baby, so they are taking pills. So they are finding a lot of difficulties on their menstrual irregular. After few years, they are finding a lot of cyst. So we are giving only neutral medicine, like pulsatilla, a little bit. Then he is getting normal. His hormonal balance is returned. Then he is healed. So we don't do any complexity in my body. That's my thinking. My father mission. And my father wrote 40 books. We published 23 books. And we are teaching these types of things in our coaching center or in our country. So not only homeopathy, in this World Homeopathic Day, I am really happy to found our mentor, Dr. Parveen Jareen. Thank you, dear, from my heart, because I am so little. I don't know nothing. You are all are most senior. I want to follow you, and it will be a great opportunity for us that you give our time. And most of the Bangladeshi, they don't speak in English, and they are asking me, they translate in Bangla. So I think this barrier will be broke. Because here in my country also a wonderful doctor, homeopathy doctor, allopathy doctor. So this barrier will be broken by your platform. And in this situation, I found most of the homeopathy doctor, most of the allopathy doctors, they are getting failed because antibiotic is resistant in my country. In every pharmacy, antibiotic is really easy to buy. If you go there, you said, give me a little bit antibiotic. They can easily give. In Bangladesh, 175 million people. So many people. Means more than 180 million people. Okay. So the allopathic medicine, they are getting business and business. Their motive, they are getting business and business, and we don't against allopathy doctor. Okay, we don't against allopathy doctor, but we want to say a real thing. What is real thing? The real thing is that you should detoxification your body from chemical drug. Okay, that's our mentor said, a man's body like a balloon. You said most of the time you said this word, a man's like a balloon. So yes, this is the main thing. And my father, he teach me homeopathy. I learned homeopathy from my father. In this day, I pray my God, give to my father a wonderful heaven. And thank you, dear. Thank you, everything. Huh? Thank you, everybody. And dear Parvin Jareen, thank you, Dita.
Yeah, thank you. Thanks for organizing this event. It was a great event, and hopefully we can ask everybody, we can invite everybody to come to our next conference, which is on April 25th. And this is that conference is from the Academy, and actually Dr. Ullah also is a speaker there. But I'm gonna have two presentations on the intersection of philosophy of healing and science of medicine, and we're gonna elaborate, and I'm gonna open it up. Today it was just very, very, very short, but I mean, if whoever wants to know exactly.
We find my father's friend. Hello, dear Abdul Kabir Kaka, do you hear me?
Yeah.
Hello?
He doesn't have a voice, a sound, so yeah.
He's trying too much, but it's a technical issue.
Yeah, maybe we can invite him to come for the conference, next conference, hopefully. And because I have to go as well.
Yes.
And yes, and yeah, thank you. And yeah, so hopefully we can see Dr. Vesna, we can see Dr. Oren, Dr. Tommy, Dr. Anwar, Dr. Azizo to join us, Dr. Esty, and yeah. So and we're gonna have a big conference. It's all day on the 25th.
Ma'am, could you give me some time when you go? I will close the meeting, but could you give me some time?
Yeah, you can. If you want to continue, you can. Yeah, you can continue, but I don't know if you can close the meeting from your end.
Okay, I will leave. Then I think everybody will leave. Is it
okay? No worries. So go ahead, and the only thing that you said is 2 hours, and yeah, go ahead. It's on. And I thank you again, everybody. Thank you, Dr. Ola, and hopefully see you soon in next 2 weeks. Take care of you.
Of course.
Bye-bye.
Thank you.
Bye-bye.
Good night.
Dear Dr. Abdul Kabir Kaka, do you hear me? Unmute. Unmute করেন। হইছে তো, unmute করেন। আনমুট করেন, লাল বাটনটা, এই যে দেখেন লাল বাটন আছে একটা পাশে, হ্যাঁ, এটা আনমুট করেন। আনমুট। হ্যাঁ হয়েছে, বলেন শুনতেছি। হয়েছে তো? কি দিল মোবাইলটা? বুঝতেছি না তো কাকা আপনার কথাটা।
স্যার আনমিউট করছে, আর পরে কথা বোঝা যায় না।
হ্যাঁ, বুঝতেছি না। আপনি এই যে হেডফোনের ওই ইয়াটা বের করতে হবে, হেডফোনের ওই যে ক্লিপটা এটা ক্লিপটা বের করেন। এই যে দেখেন, এই যে মোবাইলের পিছনে একটা ক্লিপ আছে, ক্লিপটা বের করেন, ক্লিপটা। আরে কি করতে পারি বলেন তাইজুল ইসলাম সাহেব?
কিভাবে বলবো, কাছে থাকলে বুঝাইতে পারতাম।
তুমি দেখো তোমার মোবাইলে নিয়া তারপর বলো এটা খুলা ফেলো, দেখো তোমার হেডফোনটা নিজের হাতে এটা কান দিয়ে খুলা ফেলো।
হেডফোনের ক্লিপটা এই যে দেখেন, এখানে হেডফোনের ক্লিপটা খুলেন, হেডফোনের ক্লিপ।
ওই জন্যই কথা বুঝা যেতেছে না, হেডফোন থেকে কানেক্ট করে কাছে বলি আর
এই যে হেডফোনের ক্লিপটা একবার খুলে ফেলেন, এই যে দিলেন না, আবার খুলে ফেলেন, খোলার পরে আসে না। একবার বের হন, বের হয়ে যে আবার ঢুকেন, বের হয়ে যান।
আবার মিউট হয়ে গেছে স্যার।
কেউ নাই ওনার অফিসে?
কেউ থাকলে তাহলে বলো।
শাইখুল ইসলাম ভাই তো থাকার কথা।
টাকা আমি চেষ্টা করছি।
আরে উনি বাসায় যায় নাই, অফিসে।
শাহিদুল ইসলাম ভাই নাই তো বলেনি,
অনেক
গ্রুপে নাই।
এবার কথা বলবো।
হ্যাঁ হ্যাঁ, বলেন বলেন। মোবাইল একটু কাছে নিয়ে বলেন তো। হ্যাঁ, বলেন।
নেটওয়ার্কের প্রবলেম বা কোনো সমস্যা।
না না, একবার বের হয়ে আরেকবার ঢুকেন, বের হয়ে আরেকবার ঢুকেন। লিঙ্কটা আছে আপনার কাছে? এভরিবডি আর গেটিং আউট। কাকারে কলই দি। আর এই রেকর্ডটা থাকলে তো কালকে তো রেকর্ডটা আপলোড করবেন। কল ধরেন, কল ধরেন, কল ধরেন। ধরেন ধরেন। হ্যালো, মোবাইলটা চেঞ্জ করতে হবে। হ্যাঁ কাকা, কাইটা দিল, কি করতাম।
হ্যাঁ।
হ্যালো ডিয়ার আঙ্গি।
Dr. Namatullah,
Mhm.
what is your YouTube that you have recording about the lecture? What's your YouTube, please? You have a link?